afternoon. I'm a second year paramedic student. How are you today?
Good, thank you.
What was your name, sir?
Ben.
Hey Ben, what I'm going to do today is a cardiovascular physical examination, and what that's going to do is help me have a look at your heart. Is that okay?
Yep.
I'm going to have to feel and listen to your chest and your tummy, but anything else I'll let you know, okay?
Okay.
If you just take your shirt off for me. So at this point I get my secondary officer to be doing a full set of vital signs: blood pressure, rest rate, pulse rate, temp and BSL. And whilst they're doing that, I have a look at my patient. I'd make sure they don't appear to be in any pain, they look comfortable, or the opposite, notice what pain they're in and if they're uncomfortable. Make sure there's no pallor, so no paleness of the skin, and no cyanosis. So there's a nice pink tinge to the skin and no blue. Then I'm going to come in and have a look at the hands. So if you just raise your hands like this for me. I'm looking for any xanthomata, which are yellow lesions on the skin. I'm also looking for cyanosis and pallor again in the hands. Turn your hands over for me. Looking for any red or white lumps, maybe symbolizing endocarditis. And again, cyanosis and pallor. Is it present? And then put your fingertips like this for me. And then looking at the fingertips, seeing if there's any clubbing. Making sure the fingertips touch and don't pull away from each other. Just put your hands back like this for me. I'm going to come in and feel for a radial pulse, noting its rate and rhythm, whilst also doing a rest rate at the same time. And then I'll come and assess the other side, also noting its rate and rhythm, and comparing the two to make sure there's no pulse delay. Then I come up and feel for a brachial pulse, noting its rate and rhythm. I'm just going to move your arm up sharply, okay? Let me know if you have any pain. And then moving the arm up swiftly to make sure there's no collapsing pulse. I just need to feel your neck. If you could turn to the left. So now I'm just feeling for a carotid pulse, noting its rate and rhythm. And back to me, thank you. And doing the same on the other side, comparing the two. Thank you. Now I'm going to assess the face. So if you could just pull your eyelid down for me. So I'm looking for any conjunctival pallor, so making sure there's more pink in the tissue there than white, and any jaundice, so no yellowing tinge to the skin. Thank you. And then if you can just show me your teeth and your gums, making sure there's a nice pink tone to the gums, making sure there's no pallor, and under your tongue, thank you. And again, making sure there's no cyanosis under the tongue, so there's more pink than blue tones. Thank you. And then just having a look at the eyes, looking for any xanthelasma, so any yellow lesions around the eyes. Next, I'm going to have a look at my patient's chest. Make sure there's no scars or deformities. So if you could just lift your right arm for me. Thank you. And your left. Thank you. I'm just going to have a feel of your chest, okay? I'm going to come in and feel for any apex beats or thrills. And then any palpable murmurs. I'm just going to have a little listen to your chest, okay? So I'm starting off in the second intercostal space on the patient's right for the aortic valve. Deep breath in and deep breath out. Okay, just breathe normally now. And then the second intercostal space on the left at the sternal edge for the pulmonary valve. Just making sure there's only first and secondary heart sounds, no added sounds. And then coming down to the fifth intercostal space for the tricuspid valve. And then at the apex for the mitral valve. Then just flipping my stethoscope to the other bell and repeating the process. Okay, thank you. Now I'm just going to look for any visible JVP, so if you can just turn your head to the left for me, scoot your bum down a little bit, making sure my patient's at a 45-degree angle. So at the moment there's no visible JVP. Do you have any abdominal pain today? Do you mind if I push on your tummy?
Sure.
And then just pushing about where the liver is. Just turn back to the left for me, making sure that jugular venous pressure doesn't increase and make it protrude from the neck. Okay, thank you. I'm just going to have a little feel of your tummy, okay? Then I'm going to palpate the stomach, make sure my patient isn't in any pain, doesn't have any tenderness or abnormal masses. And then I'm going to have a listen to the stomach for any abnormal sounds. Just noting the quality of my bowel sounds. Thank you. And if you could just sit forward for me. So now I'm just going to have a look at the back, just like I did with the chest, making sure there's no scars or deformities. Then I'm going to come in and percuss the lower lobes of the lungs, listening for any effusion due to edema. And then I'm going to have a listen to the lower lobes of the lungs, again listening for any pulmonary edema. So if you just take a deep breath in for me, and out, and in, and out. And then having a look for any sacral edemas at the base of the spine. You can sit back now, thank you. Now I'm just going to again listen to the heart in 2 different positions. So if you could just turn to the left-hand side for me onto your hip. And making sure that everything I hear here is just the same as what I heard before. And sit forward for me. Take a deep breath in, blow it out and hold it out. And again, noting any changes. Okay, you can sit back, thank you. Next, I'm just going to feel for the pulses in my lower limbs. I'm just going to feel in your groin here, okay? So feeling for a femoral pulse, noting its rate and rhythm, and doing the same on the other side. Again, noting its rate and rhythm and comparing the two. Coming down and feeling for a popliteal pulse. So if you can just pop your knees up for me. Again, comparing the two's rate and rhythm, making sure there's no delays. Then coming down and feeling for a posterior tibial pulse. And the same on the other side. And then coming and feeling for a dorsal pedis pulse. And again, comparing the other side. Then I'm going to have a general look at my patient's lower limbs. Make sure there's no ulcerations, no xanthomata again, so no yellow lesions to the skin, no scars or deformities, no abnormal masses or ulceration. Then I'm having a look at the colour, looking for any cyanosis or pallor, and having a feel of the temperature of the skin, making sure there's no heat. And then having a look at the feet, again for cyanosis or pallor, and any clubbing of the toes. That's all. Thank you very much, Ben. You can get dressed.